Are there any new treatments for depression besides for the old SSRI talk therapy? Seems like they don't work for many people. So, one really interesting new area of treatment for depression is the use of ketamine. Ketamine is a tranquilizer, it's used in anesthesia, and lately they've done a study that showed that when depressed patients took ketamine, 85% of the people in the study actually had their depression symptoms relieved in 15 minutes. And that's really crazy considering that SSRIs, which are the most commonly prescribed antidepressant currently, could take 2 to 6 weeks to work on average and only work at all 40 to 60% of the time. So when we're talking about something that's 85% effective and could work within 15 minutes, that's really crazy. But ketamine isn't really clinically available as a treatment just yet because of its high potential for abuse. The medical community is kind of hesitant to have psychiatrists prescribing it regularly. You could hallucinate if you take too much. It could be used as a date rape drug negatively, of course. So that's definitely one interesting area of treatment to look out for in the future. There are a lot of unorthodox treatments for depression in general. There's been people who have said microdosing psilocybin mushrooms and LSD have helped, though I wouldn't necessarily recommend that. But there is a little bit of at least evidence from research to show that microdosing that may help, but it's illegal, and obviously I wouldn't recommend that as a first option. Another new area of treatment is treating depression cognitively, meaning that there's a lot of evidence that when you're depressed, if you stop participating in normal activities, which most depressed people do just because they lack motivation and energy, that it actually worsens the depression when their mental processes get worse. So there's a whole area of current depression treatment that just focuses on having depressed people play brain games, and the research shows that that does work, and there are actually specialized regimens like an iPhone app called Peak, and there is evidence that those type of treatments do actually help alleviate at least some symptoms of depression or stop it from worsening. So overall, exciting new depression treatments to look out for. Well, not exciting, we're talking about depression, but encouraging, I think, is a better word. Ketamine and maybe microdosing certain psychedelic drugs, but again, I wouldn't recommend these two right now because they haven't been proved totally by the science, and there's also a lot of downsides and side effects of taking these medications. But I would definitely try some sort of cognitive therapy, like playing brain games on a specific specialized regimen if SSRIs and talk therapy hasn't worked thus far. But yeah,